Fabulous. Thanks so much, Greg. Thanks very much for the opportunity to present today. I'm very honoured to present to such a large crowd. Welcome to everybody else to the webinar today. I hope that everyone will receive some clarity about the options and uses of pain relief in production animals and get some guidance for what is best practice for people within Australia and across the world. I know we do have some international registrations, so that's very good to see. Firstly, I want to discuss what is pain. So there's an international association for the study of pain, and it describes pain as an unpleasant sensation associated with actual or potential tissue damage resulting in physiological and behavioural changes that indicate a stress response. So that's quite a complicated definition even for a vet to understand. So basically what it means is that pain has three components. It's physiological, pathological, and psychological or emotional. Essentially, these respond to a stimulus that's actually or potentially causing damage to the tissues. It causes nerve impulses to fire along pain-specific nerves towards the spinal cord and the brain, and that's how the animal registers that it's in pain. The physiological impact is what the animal feels as a direct result of the stimulus. It provides as a warning to prevent further pain, but no tissue damage is actually involved at that stage. So a good example of that is when you put your hand on a hot stove and you pull it away before you actually realise what you've done, and that's just a reflex action there. Then we have pathological pain, which is caused by tissue damage and creates inflammation, which creates a wind-up loop and results in continuous pain. So that is actually when you leave your hand on the stove for a little bit too long and you get a burn, which has got tissue damage. So that then causes that pathological pain. Then we've got psychological pain. So that's when we have a consciousness of the pain and it has long-term effects. So now that you've burnt your finger, you've learnt not to touch the stove. These stimuli work together to cause a protective response. So consciously, the animal then attempts to escape or avoid the painful stimulus in the future, or at an unconscious level, that withdrawal reflex when you first touch that hot stove. There also are cardiovascular responses and inflammatory markers that come on in the within the animal. So I've just got a pictorial image here of these different pain processes. Firstly, we'll talk about acute pain. So this first cow here is suffering from acute pain. So that's a protective mechanism that's defined as an everyday experience of discomfort that occurs in response to a simple insult or injury. Acute pain makes animals notice an injury and move away from the danger that first caused the injury, and thus it's generally short-lived. So our first cow here, she's trodden on a sharp rock. She gets a little pain stimulus that runs up here to her spinal column, and then there's a feedback loop to the brain, tells her to pick her foot up before it hurts anymore. Our second cow here, the second cow is suffering from chronic pain. So the sharp rocks actually penetrated her foot, and now she's either got a severe stone bruise or abscess. So chronic pain is, may or may not be associated with brief injury, but it's generally associated with inflammation and changes to the nerve cells in the spinal cord and the brain. This cow is now suffering from what we call wind-up, which is a phenomenon that causes an increase in the sensitization of the nerve cells, and then something that normally deemed mildly painful becomes very painful after repeated insults. So we can see we've got repeat reflexes going up to the spinal cord from her sore foot, and that causes repeat reflexes from the spinal cord to the brain. And every time this little cycle goes on, the cow gets a little bit more sensitive and the pain sensation is more. In addition, changes in the spinal cord and the brain can make this chronic pain more resistant to treatment of analgesics. And this pain is quite common in livestock, especially looking at lame cows within a dairy. So as I sort of said, we can start with something small, a little sharp stone, and it gets bigger and bigger, and then we get to this point of no going back, like snowball effect, until we've got this giant avalanche and no amount of pain relief is going to help this cow at this point in time. So I guess the question is, how do we stop this wind-up pain? Firstly, we can use local anaesthetics, which stops the detection of the pain messages. So it literally blocks that message getting to the brain. We can either block it at the level of the nerve or at the spinal column. The important thing to realise here is that pain message still exists in the original form, and as soon as that local wears off, full strength pain message will still break through and start that wind up process. Secondary, we can use anti-inflammatories, so either oral or injectable, and these dampen the pain message. So as a result, we get smaller messages going to the brain, and this results in less pain wind up, which is better for the welfare of the animal. Of course, with these, timing is everything. The greatest effect is seen when drugs are given prior to the procedure, so they are at full effect when the procedure starts. Just to go back over inflammation a little bit more in detail. So inflammation it's really important. It's a protective response stimulated by injury or destruction of tissues, which serves to destroy, dilute, or wall off both the injurious agent and the injured tissue. So without inflammation, we can't heal, but excess inflammation causes delay in healing. This inflammatory response can be provoked by physical, chemical, or biological agents, including mechanical trauma or infectious agents such as bacteria, viruses, and other pathogenic microorganisms. Although these infectious agents can produce inflammation, infection and inflammation do not always go hand in hand. So we can have one or the other or both together. And the classic signs of inflammation are heat, redness, swelling, pain, and loss of function. Animals can experience pain for a number of reasons. So these can be as a result of the disease processes commonly present on farms. For example, lamenesses, 3-day sickness, joint or navel ill, eye problems, pneumonia, and many other diseases I'm sure we're all aware of. Or they can be due to human interventions as part of our common husbandry procedures. So disbudding, dehorning, power docking, castration, cesareans, abdominal births, assisted births. So it's quite a common thing that animals experience pain in our hands. Okay, so pain relief is indicated for the reduction of pain, such as surgery, including castration and dehorning. So obviously, as we saw in our little survey then, that's what most people are using it for. It's also very important in treatment of diseases such as diarrhea, pneumonia, and mastitis. So not only will it reduce the severity of the disease, but it may actually reduce the duration of the symptoms as well. With surgical procedures, best practice involves using anti-inflammatories 10 minutes before the procedure and topical or local anaesthetics at the time of the surgery as well. Let's talk a little bit now about how we recognise pain in animals. So one thing that we use quite commonly across all medical groups is to estimate the pain score. So if you've ever been to hospital for surgery, the nurses will have asked you probably many times in recovery to estimate your amount of pain on a score of 1 to 10. So this is a little chart that it's going to come up for me that gives us an estimate of the pain scale in calves. So interesting to note that they've estimated that dehorning is as painful as a broken bone, and also that castration using rings and scalpel braids rank the same, but using physio is at a higher level. We'll then go on to how we can assess pain in livestock. So animals can't verbalise when they're in pain. They can't tell me that they're feeling a sore 3 pain. So quantification of pain is quite difficult. Animals will show pain in a number of different ways and range in subtleties from a mild postural change, such as the abnormal head or ear position, to being totally recumbent and unable to get up with extreme vocalization. Pain is very difficult to assess in production animals, but investigative mechanisms have been developed to overcome this lack of overt pain signals. We use measurements in hormone levels such as cortisone, haptoglobin, and white blood cell count to indicate the presence of pain or inflammation. And they also use what they call a pain ethogram to score specific abnormal behaviours and postures that are known to signify pain. So they can use statute standing or standing hunched or stretched, whether they're walking stiff or kicking and foot stamping. And they just measure that, how many times they observe that over a certain time period, and that gives us an indication of how much pain that animal is suffering. Then we want to look at, why is less pain more important? We know that pain's real, but why is it important to us? So we know that pain changes behaviour. Livestock that are suffering from pain, they move around less, they'll feed less, and this results in slower recovery from injury, illness, or surgical procedures. It results in checks in their growth rate and also increases their risk of predation. On the physiological level, pain is equivalent to stress. It results in stress, which causes an increase in adrenaline, cortisol, and they're cumulative with multiple procedures. So if we are branding and dehorning and castrating all at the same time, we've got multiple pain stimuluses affecting that small little sphere. So it produces more cortisol, which also has a secondary impact of suppressing immune function and growth rates. These animals that are stressed and in pain are also more prone to infections and poor healing during the stress period. We know that calves that are treated with pain responses, anti-inflammatories, are less likely to record a health event in the weeks following a castration. So negative impact on pain. The impact of pain can be seen for up to 90 days post-procedure, which is quite a long time when you think a lot of time we're doing these management processes, when we're expecting them to grow the most. So if we're doing them before they're weaned, we want to get the most out of that calf so it could be a decent sized weaner. So for up to 90 days, you can have reduced feed intake, which results in reduced growth rates, and it also causes poorer carcass traits. Animals suffering from pain are also more likely to record a health event in the weeks following the intervention. They'll take longer to get onto feed and also have a longer time for recovery from illness and chronic lesions. I think we've gotten beyond the debate as to whether or not we should be using pain relief in animals. It's fairly well established amongst industry and health professionals that that is definitely important. We all know the sheep industry was forced to adopt pain relief during mulesing, and I hope the cattle industry will follow suit and voluntarily adopt industry best practices which ensure the welfare of all animals in our care. Welfare is often seen as a dirty word, but it covers more than just preventing a protest by Animals Australia or PETA. By adopting the use of pain relief, we can actually maximise profits and production. And at the end of the day, every decision we make on our properties comes back to production and profits. Australia is a leader on the world stage in animal production, and we should be giving an example for the rest of the world to follow. The objectives of pain management are to alleviate acute pain from the procedure, to minimise chronic pain post-procedure, and to do this in the most practical means possible. Best practice pain relief provides lifetime benefits for the welfare of the animal. It helps maintain access to high-value markets for producers and helps meet the industry's strategic goals on improving animal welfare standards. To sum that all up, we want to regain the normal body functions for animals as soon as possible after illness or surgery. So let's follow on with some research that's been done on the benefits of pain relief. So effective pain relief can help improve growth rates. As I said before, we know that marking procedures are incredibly painful. It's up amongst the most painful things that an animal will experience. And this is a study that was done to compare the growth rates in calves post-marking, post-disbudding. So we can see that in both groups, calves showed significantly greater weight gains measured at 10 and 30 days following those procedures over those that received no pain relief at all. The signs of pain are often masked as a survival mechanism. We all know about survival of the fittest, and a calf that is showing signs of pain is maybe targeted by the lion in the savannah. So they will mask those, but we can measure that in terms of growth rates and other things, and feed intake in that 90-day period, and we know that pain relief definitely does help there. Road transport is one of the most stressful events encountered by feeder cattle during their productive lives. It causes inflammation and acute phase responses. There's quite a nice study conducted in Oregon, where they transported some steers 1,440 kilometres to a feedlot. They were given a treatment of meloxicam before loading and then after arrival. Those steers that were administered the meloxicam showed less performance losses caused by long distance transportation by inhibiting changes in metabolism and feed intake. It also resulted in increased average daily gains in dry matter intake during the receiving period. They did sort of say that they'd like to conduct more research to determine whether there's a decrease in the incidence of illnesses during that induction period as well. So what pain relief should be used and when? We know that there's quite a lot of options out on the market, and it can be quite bamboozling for a lot of people. So we know that research has shown that acute pain from marking persists for at least 48 hours past the initial insult. And ideally, the pain relief should outlast this acute pain period from the marking procedure, so we don't get that wind up that I spoke about earlier. Local anaesthetic is one choice. It only lasts effectively for 2 to 3 hours, and then the calves will show significant pain as that local anaesthetic wears off. Oral and injectable anaesthetics typically last 48 to 72 hours post-administration, but they do take 10 to 20 minutes for full effect. So if we're giving them at the time of procedure, that means there's a little lag phase where they do feel pain. So how do they work? Local anaesthetics block the messages getting to the brain. So the message is still sent from the injury, but doesn't get through. This is similar to an epidural given during childbirth. Pain is still there, but it's not recognised for several hours until it wears off. Anti-inflammatory, so your orals and your injectables, they work by reducing the amplitude of the pain messages. Unfortunately, they don't always block all these messages getting through, but if the message is smaller, then the wind-up is less. So trisulfan, that's our topical anti-inflammatory. So it's a multi-drug product. It's got some local anaesthetic in it, it's got some adrenaline that will stop the bleeding, and some anesthetics to stop some post-surgical infection. It is available just through your local reseller and has a label claim for 24 hours duration of action. It does still have that little 10-minute lag phase before it starts to work, and also has a really long meet withhold period to be aware of if you're in a market where that's important to you. Buccal is our oral paste. It's a nice blue sticky paste that is absorbed through the mouth. It does take that 15 to 20 minutes to work, and in cattle has a 14-day withhold period. Meloxicam injectables, of which Medicam's an example brand here, they do have the longest duration of action, 72 hours, and again have a lag phase before they work. And they do have the shortest withhold period available there. So there's some options for you available, just so people are aware of what's out there. And this is a very interesting chart. It's specifically the study was done using rubber rings, but this chart probably you could change them at the top to any of the other interventions that we do. So we can see that there's an acute pain phase here, where we've got quite a spike in the active pain behaviours. These are most significant in the first hour, but behaviours will continue into the chronic phase, which goes well past 24 hours. So these here are our local anaesthetics, our trisulfan. We can also use injectable local anaesthetics in terms of nerve blocks, which is quite common in the dairy industry, disbudding calves. So they're most effective in the first hour following procedure, and then tail off once we get to the chronic phase. On the other hand, we've got our injectable and oral analgesics up here, which are not so effective in this initial acute phase, but they're fully effective within an hour of administration, and then protect us from this chronic pain phase, which gives our production losses further down the track. As you can see from this chart, the gold standard for pain relief is to use both of these together, so that the initial pain reflex is blocked, so the calf doesn't feel the pain when he's castrated or dehorned, and then he doesn't suffer the wind-up effects later on. I've just included this table here for completeness. So when you get your copy of the PDF, for those of you who haven't got them already, it does cover most of the products available on the market. There are a couple of other generic meloxicams available, which do similar stuff to the Ilium meloxicam. So just so you can go back and review your options at a later date. So we can see that back in 2018, only these studies came from surveys from producers, similar to what we've done today, but obviously on a wider scale. So only 4% of respondents said that they were using pain relief, whereas we're up to 21% in 2020. So easily got out 25% rise in use of pain relief that we've seen in this group. I think we've got a fairly skewed audience today. We do have more people in our audience using pain relief than the respondents in this survey. There's obviously people who are interested in pain relief wanted to listen to my talk today. I think if we can continue to grow and follow this trend over the next few years, it'd be nice to reach an 80% uptake in the next 4 or 5 years, and that would be a really nice place for our industry to be. So yes, particularly like to thank Dr. Liz Pryor. She's very passionate about farm animal wellbeing, and her main role as Ringer is to provide advice to producers on pain relief. I'd also like to thank Nick O'Grady from Elanco and Kim Welling and Lee Metcalf from Troy for their contributions to this talk today. And thank you all for your attendance, and I hope that I've answered some of your questions.